nation overwhelmed by prescriptions? Why are more people medicated but sicker than they've ever been? Why are life-saving innovations twisted into lifelong dependencies? Why do government guidelines look more like corporate marketing plans than medical ethics? And why are doctors who question it silenced, punished, and erased? What's being sold as healthcare is an industrial system of profit built on chronic illness, endless refills, and a culture of fear. Blockbuster drugs, endless side effects, patients turned into permanent customers. No accountability, no transparency, no escape. The institutions know exactly what they're doing. The regulators protect them, and the cost is paid in broken bodies, wasted money, and lost trust. Welcome to the GoldCare Medical Town Hall. Cracking the Pharma Code. This conversation won't comfort the system. It confronts it. It brings together voices who know the system from the inside. Pharmacist and functional medicine specialist Robert Seik has deep insider knowledge of the pharmaceutical industry, revealing the precise course of corruption within the Big Pharma machine. Dr. Bryan Atkinson, board-certified physician and GoldCare's chief medical officer, exposing how bureaucracy eroded ethics and integrity in clinical practice. And Dr. Simone Gold, physician, attorney, and founder of GoldCare, leading the movement to rebuild medicines around truth, freedom, and faith instead of profit. Together, they'll expose how modern pharmaceuticals were designed to keep patients dependent, how marketing silences dissent, and how a new model of care is rising in response. The code unravels now. Stay focused, stay sharp, and see what few have ever been allowed to see.
Welcome to GoldCare Medical Town Hall. I'm Drew Kachurik. Thank you so much for being here. Joining us tonight is Dr. Robert Seik, pharmacist, entrepreneur, and functional medicine expert. With decades of experience in the pharmaceutical and biotech industries, he offers an insider view of how the system traded healing for profit and shares practical strategies to restore balance, independence, and true wellness. Also with us is Dr. Bryan Atkinson, GoldCare's chief medical officer, bridging conventional and holistic care to help patients break free from medical dependency and rediscover true wellness. With a focus on integrity and transparency in medicine, he leads GoldCare's mission to make healing honest, accessible, and patient-driven again. Our moderator tonight is Dr. Simone Gold, founder and CEO of GoldCare Health and Wellness. We're told modern medicine is saving lives, but skyrocketing prescription rates, mounting side effects, and lifelong drug dependency tell a different story. Is this really healing or a profit-driven system keeping people sick? Why won't doctors and politicians confront the truth? You'll learn tonight about how modern medicine saves lives, but keeps us hooked on lifelong prescriptions, how Big Pharma turns healing into profit, and how to break free. Lastly, we'll also show you how to make informed choices and reclaim control over your health. To gain access to hundreds of conversations like you'll hear tonight, plus an extensive library of medical educational materials, click the link below or visit goldcare.com/Dr. Gold to get your first month on us. And now it's my pleasure to introduce our moderator, Dr. Simone Gold.
Shall I get started? All righty. Sorry, everybody, about that little brief delay there. So I'm very excited for tonight's town hall. As some of you know, we do this every month, and we want to show you a better way to access what we've come to call healthcare, but isn't really healthcare in the medical industrial complex in the world at which I left. Most of you know, I was a board certified emergency physician for 20 to 25 years. And I saw a lot of things in the system that needed to be fixed. And during the COVID years, I saw things that were downright deadly and policies that were bad for patients. And because of that, we built something better. There were two huge problems that were revealed during COVID. That was physicians who were really not doing the right thing by their patients. And it was pharmacists, and especially chain pharmacies that interfered in an extreme way with the doctor-patient relationship. Just to remind everybody that I'm a lawyer as well, and I was deeply offended at watching the chain pharmacies especially break all their pharmaceutical regulations. It's very clear in the law that pharmacists dispense medications, but physicians prescribe medications. That comes with a whole host of rules to follow, including, for example, that pharmacists are not actually allowed to ask patients their diagnosis. That's probably surprising to many of you listening, because we all know during the COVID years, it was normal, or I should say it was common for the pharmacist to ask you your diagnosis. You might have thought it was a normal, legitimate, fair question. It's actually not a normal, legitimate, fair question. It actually violates the rules. So there were tons of examples like this where chain pharmacies were really being encouraged to interfere aggressively with the doctor-patient relationship. So if you were lucky enough to have a physician who was awake and not woke, you still had a big choke point at the point of the pharmacy, about the point of trying to get your hands on medications that you perceived that you needed. It was always going to be a point that we'd have to fix at GoldCare. We needed to find doctors who were awake and cared about their patients, but we also needed to find pharmacists who also cared about patients, who were happy and joyful about being pharmacists, were happy to, practice their profession of pharmacy, working alongside of physicians. And we're so happy to have, I met Dr. Seik, pharmacist, many years ago during the COVID years, and we partnered with him on this area. So this is really a two-part problem, solving the problems for people, which is you need a physician and you need a pharmacist and pharmacies that will help you. And that's what tonight's town hall is really all about. So we are I'm very much in favor of modern pharmaceutical treatments that exist that are good for patients. God forbid anybody would think that I would throw out the good with the bad. Of course not. There's a lot of prescription medications that we need to have. I mean, you can have life-threatening bacterial infections that you need to have medication for. Antibiotics, blessedly, since the 1940s, we started having antibiotics, and that has saved countless numbers of lives. We also have powerful anti-inflammatory medications. We've got lots of medications that really just reduce people's symptoms, if they need it. These are all good, strong, wonderful pharmaceutical medications that we don't want blocked from patients' access, and we just don't believe that if we don't take matters into our own hands, that people will have that kind of access going forward. So that's kind of a long introduction to tonight's talk. I'm going to turn it really over. I have a couple questions for you, Dr. Seik, which is, I guess you can start with, like the COVID years, obviously that opened your eyes. You knew about all these problems, but I guess it got a lot more acute during the COVID years. And what do you see kind of globally as a problem for people with pharmacies, independent pharmacies, chain pharmacies, and things like that? I think that's an issue that most people don't know about.
Thank you for having me on. Good to see you, everyone, again. Dr. Gold, it's a pleasure. And I can tell you, as a pharmacist who actually spent time working in the drug industry, it's really interesting, my career arc, and alarming in a number of ways what I saw. So let's bring it briefly from my beginnings as a licensed pharmacist to COVID, where what I saw immediately working as a dispensing pharmacist, which I didn't like. I wanted to get a better job, and I thought at 25 years old, the drug industry was the way to go. But as patients came into the pharmacy to pick up medications, the older they were, the more medications they were on, and the sicker they were. This just didn't sit well with me. It's more medication. And I retreated from that because this certainly wasn't healthcare. And I went to the drug industry to get an education, number one, but it was a better job. And I did spend time doing clinical research, which I thought at the time was a more pure pursuit, but it turns out that wasn't either. But let me tell you what I see to echo some of your comments. The problems we have today that I see from the perspective of someone trained in functional medicine. Why did I get trained in functional medicine? There is a handbook for pharmacists and practitioners. It's called the Drug-Induced Nutrient Depletion Handbook. All medications have a nutritional cost. Some have a greater cost than others. And when you have a patient who takes drugs that simply deplete magnesium, for example, well, you as an ER physician know magnesium is so crucial for over 400 metabolic reactions, you're going to cause problems. These are side effects or something that manifests as a need for yet another prescription drug, which is not solving the problem. It's leading to yet another nutrient depletion. So this is not the body's natural biologic function. This is atypical. This is using the medicines. And what's really
My goodness. Unfortunately, Dr. Seik got frozen. I hope he joins us again in a moment, but it's I think he's anyway. So Dr. Seik, he'll join us again in a moment. But what he's really referencing is the fact that all medications have side effects, and sometimes we doctors have, very much we've minimized that possibility. That doesn't mean you should never use them. It doesn't mean they're all verboten at all, but it means that they have to be done intelligently and wisely and with informed consent, being, most of all. So I'm not sure if he was going to say this, but I'm going to say it for him. Dr. Seik is actually an independent pharmacist, so he actually spends time with the patients that come in to see him, and that's obviously a very different experience than when you go to a chain pharmacy. He also didn't abandon his patients during the COVID years. So Dr. Atkinson, I want to turn next to you, which is, we've been working together for a lot of years, and we always knew, right, that there's a two-part problem, which is the doctors and the pharmacies too. And again, people really underestimate the problem of getting their hands on medications when they needed it. But in fact, I think it was easier to find a doctor who would prescribe for you than it was to find a pharmacy who would prescribe for you during the COVID years. So we started working on this very early. And, what is your perspective on the importance of making sure that everyone has access to prescription medicines if and when they need it? Like, how did you think about this problem?
Yeah, thank you, Dr. Gold. Thank you for inviting me to be on this town hall tonight. And like Dr. Seik and like yourself and like so many other doctors, we were, I think, all rather shocked with what happened at the time of COVID, when we saw that physicians made decisions to prescribe certain medications. Obviously, hydroxychloroquine, ivermectin were the key culprits, as it were, of the COVID era, and to find that the powers that be, quash that and somehow managed to take over the dispensing of the medications through the pharmacies by, I think, getting them at the corporate level. I think the Walgreens and the CVS pharmacies, the Walmart pharmacies, they were able from on high to sort of threaten, as it were, their pharmacists that were dispensing medications. I think I may have in fact heard it from you that pharmacists would have alerts show up on their screens. Let's say ivermectin, and you alluded already to pharmacists then asking for diagnoses. So a prescription comes in for hydroxychloroquine. The pharmacist wrongfully is asking for a diagnosis, but if that diagnosis is lupus or an autoimmune disease, which is one of the major indications for hydroxychloroquine, they would dispense it. If the diagnosis, given by the patient was, well, I think I got this COVID. Well, go home, turn blue, and then
Right.
the story. So, how did I approach the idea of prescribing medications? Well, first of all, from a perspective of wanting to be very judicious and careful about prescribing, Dr. Seik already was starting to allude to some of the detrimental effects potentially of pharmaceutical agents. And perhaps I can tell a little story about that. My background is actually in neurology, and I'm also a hospice doctor. Did a fellowship in palliative medicine and hospice, and worked in hospice for a number of years. And Dr. Seik was just saying that, patients would come in, the older they got, the more meds they were on and the sicker they seemed to be. Well, in hospice, you have people coming on who are at the end of life very often. It shouldn't be at the very end of life, but often it is. Unable to perhaps, speak, open their eyes, eat or drink. They're taking 7, 8, 9, 10 medications. I can tell you as a hospice doctor, over and over again, we would bring a patient into hospice, stop basically all of their medications except for a few symptomatic medications that we use in hospice regularly. And the next morning they would wake up, they would sit up in bed by the end of the day, they'd get out of bed and into a chair, and they would have weeks of life. And I saw it without a shadow of a doubt. It was the medications that were their bodies were, they're very, very sick. They have terminal illness. Their circulatory system is poor. Their hepatic or liver function is poor, so they're not metabolizing those meds. So they were sitting in a stew of toxicity that just stopping medicines helped. So I feel like anybody who's taking 3, 4, 5 medications is probably suffering without knowing it, adverse effects from those medications. It's diminishing their overall function. So we approach medicines at GoldCare from the idea that we want often to de-prescribe, which is a concept where we're actually looking to see, well, you've got a list of 7 meds. Maybe there are 2 or 3 of those that are not doing you any good and may be harming you. Maybe we can get you off of those medicines. We can improve your health by getting you off of those medications. And then looking at things from a holistic or naturopathic perspective, as well as standard classical allopathic medicine, and looking for alternative treatments. So we want to be very cautious and judicious in the use of medications. However, as you mentioned, Dr. Gold, there are several medications that, I want to call, GoldCare's list of essential medications instead of sort of like the WHO's list of essential medications. So there are some I just think we ought to all have.
Yeah.
That answers your question.
By the way, I want to emphasize what you said. So, because we're talking about medications tonight, and then you gave this whole story about how you saw a lot of patients that were actually over-medicated. Overwhelmingly in America, patients are over-medicated. Like that's like a fact, absolutely. And your example of hospice patients who really kind of wake up when you take them off meds. Imagine, so if you're not in hospice, you're at home, and but you're on a bunch of meds. I appreciate what you said, that you probably are suffering if you're on meds. So we simultaneously at GoldCare work to get people off chronic medications if they don't need to be on them. Sometimes you need to be on them. Thyroid medicine is a good example. At the same time, we want you to get your hands on medicines that you need or could help you with severe symptoms when you need them. And I also have many stories about people who should have gotten medications who couldn't get medications. COVID is a huge example, but there were other examples like that. So when we were working together, Dr. Atkinson, we were thinking, well, what are the medicines that we want people to have at home? And one of the thoughts in my head was hydroxychloroquine and ivermectin, which are over the counter in a lot of other nations. Why are they not over the counter here? Well, I can't control that. That's controlled by, the FDA. But what we can do is get these medicines in the hands of people. What we can do is get other medicines in the hands of people. And that's what we're going to explain to you tonight, is how to do that and how we decided which medicines people should, have their hands on. So I just want to turn it back to Drew for a moment and then back up with Dr. Seik.
Thank you, Dr. Gold. You're exactly right. At GoldCare, we've really focused on making sure that everybody is prepared before they need their medicine. And I'm really excited to hear Dr. Atkinson talk a little bit more about this. Don't forget to retweet this live stream and click the link in the title of tonight's webinar to learn more about GoldCare. Thanks. Back to you, Dr. Gold.
Oh no, Dr. Seik, is he playing?
I'm here. I just wasn't in the frame for a second. Sorry about the connection previously, but I'm back.
No. I was gonna say, because I really, this is really the heart of it. This is the heart of it is, on the one hand, Americans are chronically over-medicated with so many medicines. As an ER doctor, people routinely came into me. If they were over 40, they were typically on 2 or 3 meds. If they were over 50, they were typically on 4 or 5 meds. That was just the norm. Doctors have begun to think that's normal. It's not normal. But at the same, so we want to work to get them off. But at the same time, Dr. Seik, we want people to be able to get their hands on meds. And not everybody knows a good pharmacist like you. So what are your thoughts about this, about working together to get necessary for life-saving and necessary for symptom drastic improvement? What are your thoughts on this for people?
It's very rewarding to me to be here. I'm very fortunate to have a business where I do not rely on patients who are overprescribed medications, because many in the public may not know, as an independent pharmacy, if I took any insurance plan at all, which I don't, I would lose money on 4 out of 5 prescriptions, but I don't want to be in that game anyway. I don't want to count my success by the number of prescriptions filled per day, watching people be over-medicated and then toxic with drugs. It's very satisfying because of the work that I do with a compounding pharmacy. And, I have several different business verticals that are very interesting and rewarding. And what's good about the acute medications is the fact that you're right. There are medications that are life-saving if the patients have access to them and understand after a practitioner consultation how to use them properly. This is crucial. And we've talked before about the number of reasons why this may be. People don't think of the emergency situations until there is a hurricane, there is a flood, there's power outage. Dr. Atkinson, hospice patients or pre-hospice patients that can't get the transportation to the practitioner, can't get the transportation to the pharmacist. And, I didn't get to make my comment earlier when we talked about COVID, but as a pharmacist, it was absolutely astounding to me, and it still is, that one of the reasons I encourage patients to have these emergency medications on hand is because they may have a pharmacist at a chain drugstore say, no, I'm not going to dispense that to you, which is appalling. As you know, it's illegal. As a pharmacist who never said no to these medications, I've had challenges from state boards of pharmacy, and it became clear to me, as you know with your law degree, by state and federal law, prescriptive authority lies solely with the licensed practitioner. The pharmacist is not a practitioner. You're correct. We are dispensing only to ensure the safe delivery of medication to the patient as the practitioner intended. So one of the challenges that I had, and I won't mention the state, was they wanted me to produce a report of all of my ivermectin and hydroxychloroquine dispensing. I refused. Without a subpoena, I'm not going to do it. Well, what was the dosing? You can redact the patient information and redact the prescriber information, but how was it dosed? No, that is still protected under HIPAA. It is a de facto way for the pharmacy board to determine what the medications may have been used for, which is not their purview. And especially when it comes to the pharmacists, I had to tell classmates, you are at risk for a lawsuit for denying therapy. That is the practice of medicine. That's like deciding to discontinue or never start a treatment because you decided as the pharmacist, not your job, it's the licensed practitioner. And I have a list of reasons why these emergency med packs are important for people to have. I never in my career have thought one of the reasons to have these is because they are on hand and you don't have to worry about a pharmacist denying therapy. I can't imagine what it was like as practitioners.
It was unthinkable. I still, honestly, I can't forget it, so I can't gloss over it. But when I look back, I still am stunned, and I can't believe the massive illegality, the massive unethical behavior. I want to emphasize something you said, and I think it was just Dr. Seik. So you need to have medicines in your home, but there's really two kinds of emergencies. I think both of you kind of went to the kind of catastrophic system emergency. There's earthquakes or hurricanes or floods, et cetera. That's one kind of emergency. The other kind of emergency is you have a personal semi-emergency, right? Like it could be just urgent, I would say. You get a cat bite, you get a dog bite, you have terrible earache, you have, terrible vomiting, whatever it is in your own personal life that could be improved with a short course of something that modern medicine can help you with. So it's really kind of two things. One is the bigger issue of the system. Is the system working? And along the lines of the system working, is the chain pharmacy going to help you out? Is the supply chain going to get broken? We saw during the COVID years that the manufacturing plants of hydroxychloroquine were actually burned to the ground, right? And most of our pharmaceuticals are manufactured overseas. I think about 95%. Please correct me if I'm wrong, Dr. Seik, but that's my impression. About 95% of pharmaceuticals are not in America. Correct?
I've seen different estimates in different periodicals, and it's a minimum of 80% manufactured overseas. It is up to 95%, depending on how you look at it, and which is astounding. That puts us at extreme risk.
So that's one whole risk is like the big supply chain issue, that there's some geopolitical event, somebody gets mad at somebody and the supply chain is choked. Another one is that there's a local emergency in your area, right? Like earthquake, flood, hurricane, things like that. Another is that the doctor isn't on your side, like we saw in the COVID year. So that's kind of one. And the other is you just have a problem in your life. You get a bad, a cut and it gets really infected or something, something like that you'd like to have treatment sooner. For all of those reasons, Dr. Atkinson and I looked really closely at what would best serve you, every person listening, what should you have in your home? These are things that I have in my home. These are things that Dr. Seik probably has in his home. Dr. Atkinson, you probably have in your home, but this is what we built. We built this for you. And we built it as practitioners to be safe and broadly effective. So what did we do in terms of safety? We have set this up in a really, actually, I feel, Dr. Atkins, I should let you talk about how it was set up, because you really did the most of the planning on this. Like how we've set it up, how we distinguish ourselves, because we do pride ourselves on doing things the right way for people.
Right. Yeah, thank you. Well, most importantly, we are the only company out there that provides these medication packs, accompanied by an appointment with a medical provider. So that, number one, is very important. And number two, we also continue to be available to you on down the road should you have a medical, an urgent medical condition or a medical emergency, to consult with our GoldCare providers. We have in the packs themselves, we have two classes of packs. We have packs related to COVID and flu. One's called an essentials pack, and one's called a premium pack. But then we have our 11 medication prescription pack. And other companies, so I do want to compare, mostly to explain that we're very much where you want to go. We are the highest value and the best product. We have 11 prescription medications. Others have anywhere from between 5 and 8 medications. The only other company that was actually doing physician consults just went out of business. That was called Duration Health. I don't understand why they went out of business, but if you try to look up Duration Health now, it just says, we're closed our doors. Call your nearest, ER or doctor if you have any questions. So they're gone. Other companies like the Wellness Company and Contingency Medical, Joyce Case, you fill out an online form and a nurse practitioner reviews it, and if there's no questions, you get your meds in the mail. That sounds nice and convenient, but I think you need to. We're not throwing the baby out with the bathwater, right? We still want to have a doctor-patient relationship such that we're available to you to discuss the medications. So that distinguishes us. I will say also the fact that we have 11 medicines. Why do we have 11 medications? Well, we were trying to decide what we needed, and we looked at what everybody else was doing, and we talked amongst ourselves. And Dr. Gold's obviously got great experience as an ER physician. Many of our other doctors as family practitioners had great inputs. And we were left with, well, there's all these medications. Maybe do we need to cut 2 or 3 or 4? Because that's what the other companies offer. And we just said, no, these are GoldCare's essential medications. We need all of them. And so that's why you get so many prescriptions, with your GoldCare prescription pack.
So there's the viral essentials and the viral premium, I think is what the packs are called. And just like Dr. Atkinson said, this was really based on collective experience from independent physicians who had no other motive other than what's in the patient's best interest. So we all had a little bit different experiences. My experience as an ER doctor, I think, was really helpful because I tend to see the people with the urgent situations, but we also needed to hear from primary care physicians, internists, and family practitioners as well. And all the common things that you can think of. Bronchitis and pneumonia and urinary tract infections and ear infections or eye infections and skin infections, and also just bad symptoms. You can have a really terrible pharyngitis and it can be so severe, and we can actually reduce that severity of that pain with prescription medications. Nausea, it's a good one. I remember the last time I was nauseous about a year ago. I'm like, oh my God, this is miserable. It's miserable to be really nauseous and vomiting. So we put all those things in. There's no over-the-counter medicines in there. We've got you covered for most things that you need, but also everyone listening to me, it is wrong to just throw these medicines out there and throw them at the patient and just say, oh, here you go, here you go. That's not it. You need to talk with a smart person who knows this, needs to advise you. And then Dr. Seik, I can't thank you enough for the excellent work that you did with Dr. Atkinson on a handout, because you really educate patients so much so that when people do this consults and they buy these medications, they get this amazing resource with them, with the medicine, so they know what it is. And then the third component is, let's say it's 6 months from now or a year from now, or let's say it's 2 weeks from now, and something happens, you have a fever, or you do get a cat bite, or you do, you have a little pain when you go to the bathroom, right? Or, right, and you don't know exactly if you should take the medicine or not, do another brief consult with us and we'll advise you if you take the medicine or not. Meaning we just want to remove the pharmacy as a choke point. We want you to be empowered from your home, have what you need, but also not to use medicines when you don't need them. That's why we do put the doctor in there, because we do want you to get the best treatment, which is often not taking a prescription medicine. Dr. C, this is how it should be, right?
It's exactly how it should be. When you were talking about the reasons why patients should have some of these medications and the early intervention, of course, you're very experienced in the ER. I just think of some of the acute situations, like you mentioned, the eye infection. One of my young sons, he got an eye scratch and started to get an eye infection. Well, of course, I have a pack at home and I own a pharmacy. But I'm thinking, what if people didn't have access to this and it wasn't a teenage boy? What if it's an older adult in their 60s, 70s, 80s? You can see the value that, you're right, you pointed out, it's only the catastrophic things that Dr. Atkinson and I were thinking of at the moment. But the importance of having these medications is crucial. And I tell you, it's very rewarding and I'm very happy to know, because I think that the only way to do this, to have these medications dispensed, is to have a practitioner consult. Because yes, the handbook is great as a reference, but that reference points to what that previous consult was. So to have access to the practitioner is crucial. I'm very pleased and proud to be working with your company because of that, because that is good medicine. That is the way to practice medicine.
I have to share with both of you and the whole audience. So as an emergency physician, right, I worked alongside a lot of other ER doctors, and I'm sorry to tell you that most emergency physicians just prescribe, shotgun approach, where they give all kinds of meds to pretty much everyone who shows up. I can tell you it doesn't take that much intellect, that much training, education, or that much care if you're just going to give everybody a whole bunch of medicines. And I saw that throughout my whole career. The trick is to use medicines judiciously. Use them if you need it. And here's a super common example. Most people don't come down with bacterial infections right away. Usually you come down, I'm not talking about like a skin infection, but if you're coughing and you feel like fluish, for example, it's uncommon to start with a bacterial organism that's causing your symptoms. Almost always, I don't even want to, it's probably close to exclusively, it starts with a virus. What does that mean? That means the moment you get sick, an upper respiratory infection, it's not really the time to say that you definitely need an antibiotic. But it's become the culture in America for the doctors to give the antibiotics immediately, for the patients to want them immediately. Then what happens is a few days later, the symptoms wear off. The patient thinks it was the antibiotics that fixed them. They often don't finish the antibiotics. They then develop antibiotic resistant organisms in their own body because they've taken a shortened course, abbreviated course. We don't want to do things that actually are bad for you. Taking antibiotics when you don't need them, not good for you for many reasons. Developing antibiotic resistance, developing diarrhea, just a whole host of reasons. But we do want you to have them when you do need them. And I just needed to give you all that example that I don't think this should be done without a wise, doctor-patient relationship going on. So that's the way we built it at GoldCare. Dr. Atkinson, we're going to go just back to you because again, we're so proud of this. We're so proud of what we built to give access to people.
Yeah, thank you. I will make a comment of a couple of meds that we decided not to include in the pack because we do want to avoid medications that might have harms. First of all, we do have ciprofloxacin ophthalmic. So Dr. Seik was mentioning, an eye infection. So that is included. So that's, topical. But we do not have cipro or ciprofloxacin as an oral pill, ingestible, pill form. That's a medication that has a lot of uses and a lot of indications. But my view of Cipro is that somehow the pharmaceutical industry was able to sort of suppress some of the harms associated with that drug. There are aortic aneurysms and dissections and tendon ruptures associated with that medication. So I do know that we're also, excluding medicines that are potentially harmful. And then one other med I want to mention is in our COVID flu packs, which we have hydroxychloroquine and ivermectin, along with Z-Paks and so forth. But we do not have Tamiflu, and I do want to caution you about this medication, Tamiflu. There's actually quite a scandal associated with it. It's a medication that is stockpiled by the U.S. government for I think for the military and so forth. So there's a lot of money going back and forth behind the scenes for that med. But the FDA approved use of that medication based, I think it was there were 11 studies, all performed by and paid for by the pharmaceutical industry, 8 of which were never published. So the raw data was never available to even view what the benefits of the medication were. And there was somebody at the British Medical Journal, the BMJ, that some years ago, pushed on this forcibly, and actually had to get a court order to have Roche Pharmaceutical release the raw data of the studies that they turned in. And when a secondary analysis of that data was performed, the drug is almost worthless. I mean, I think at best, it was something like maybe it gives you 1 less day of flu, maybe. I mean, that was like, looking at it, as kindly as you could. And there are harmful effects with that medication. So there's, the farmer-driven, medication that, has the highest, price tag, while other medications, like hydroxychloroquine, which has been around, forever, and ivermectin are suppressed. Dr. Gold, you wanted to?
Yeah, I was going to say that. I mean, I think the audience can hear that. What you're saying is we spent a lot of time as doctors carefully thinking through what are the best medicines, the safest, the most utility. It had no relationship to any pharmaceutical advertising that's happening. None of us derive any money from the pharmaceutical industry. So it's based purely on, is this the best choice? And sometimes that meant it would have been an older, cheaper, safer medicine, just like, hydroxy was. Sometimes it might be something newer, like the Cipro eye drops, for example. It just depended on what was best for the situation. The quality is really important. And it's also honestly why we partner with Dr. Seik and why we want people to specifically choose his pharmacy. He does amazing service. He cares about the patients. We know the quality of the products that he delivers to our GoldCare members. So it's all about this amazing quality. We don't put any filler stuff in there. We don't put any things that you can just go in and get yourself off the shelf. This is all prescription medications that we know and believe that you should have. It's called we actually have a few things. We have the viral essentials and the viral premium, viral essential and viral premium. I was swallowing my words, I'm sorry. The other one is called prescription pack, but I think we're going to change that to like the urgent, the urgent care pack, like the urgent medical pack to have. So if you gentlemen don't mind for a moment, I'm just going to go back to Drew for a moment and then open it up again with Dr. Seik, because I know our audience wants to know more about you personally.
Thanks, Dr. Gold. You're right. There is no worse feeling than being sick at home or having sick kids at home and having to figure out how to get a prescription called in and go pick it up and get back to your house. So being prepared and having these things in your medicine cabinet is it's really amazing. And I love what we're doing with it. We are getting quite a few questions about nebulizer-based medicines, budesonide, things along those lines. I thought maybe just briefly either Dr. Atkinson or Dr. Seik could speak to those, and does GoldCare offer those types of medications outside of the packs? There are quite a few questions being asked about it. So anyways, please retweet this live stream and check out GoldCare, goldcare.com/Dr. Gold. We'd love to have you. Thanks. Back to you, Dr. Gold.
Dr. Atkinson, would you want to take that question about that Drew posed to us?
Certainly, yeah. I mean, we had to make certain decisions, and we felt that the easiest medications for someone to receive and to store and to take were going to be the ones that we chose for the pack. Finding a little cheap nebulizer and putting budesonide in the pack and sending that along. Budesonide absolutely very, very beneficial in COVID and very beneficial in severe respiratory illness, but it was just not something that we thought was practical to put in the pack for everybody to receive. It'd be some little made in China nebulizer thing. Because
Yeah.
we just made that decision not to include that
Right.
one.
And honestly, I stand by that decision, agree with everything you said. And we had to make decisions that were most best for most people most of the time. But I also want to emphasize that we have doctors all over the nation in every single state, and nurse practitioners and PAs. Of course, they can see you, do a consult, really any prescription you need, right? Of course, you'll be able to get. So Dr. Seik, I just want to, every time I speak with you, I just always, want to remind everybody that I just really hold you in such high regard. You were a person who really stood up against the machine. Your machine was the pharmacy boards, mine was the medical boards, but you absolutely did it. You stood up for your patients. You stood up for your own integrity. And that is really why we specifically love working with you and chose to work with you. You are the owner, which makes a big difference, right? When physicians were owners, they did better by their patients than physicians who were employees. So you are the person who our patients are trusting with their medications. And I want to tell everybody, I feel super comfortable with that. And I just want to give you a chance to let people get to know you a little bit, see why I put so much faith in you.
Well, thank you very much for that. Those are some very high compliments. When we first talked, and you talked about your career background, and I learned about your career as an ER physician, and some of the reasons that inspired you to go to law school. And I remember talking with you about the fact that you were in my pharmacy, and I said you may be surprised, but you'll find in me a pharmacist that actually wants to reduce the prescribing of medication as much as possible. I'm passionate about health. And that's why I like working so much with GoldCare, with you, with Dr. Atkinson, with Dr. Jana, because the focus is on patient health. And yes, it is to make America healthy again. And maybe what that means is we reduce the toxic burden of prescription drugs. And so many people have asked me, so how can you say that as a pharmacist? Well, when I find components of my business, verticals in my business that I think are more important verticals than just counting the number of prescriptions I shove out the door, that's very rewarding to me. And a lot of that includes, honestly, a big component of my pharmacy practice is what you have on your website as well. You do use some nutritional supplements that have, very good benefits. And I just think that generally in medicine, I know that when I went to pharmacy school, there was very little education, if any, on nutrition, on vitamins. We understood them from physiology. Okay, well, you need these vitamins and nutrients, but then when it comes to therapeutics, why is this lost? Why did we not talk about nutritional supplementation or repletion of certain things in somebody to make them healthier? So, really from my career standpoint, I never predicted that I would own a pharmacy. Owning a compounding pharmacy just naturally lands one in a place where we're willing to make unique things to deliver to patients to get them to work. And of course, these common medications that we're using now, ivermectin, hydroxychloroquine, some people can't take the tablets or capsules. What does a compounding pharmacy do? We can make oral solutions. We can make other dosage forms that works. And that's kind of neat to have your own little laboratory, your own little kitchen where things work too. But often pharmacists are asked questions because all a patient has to do is pull the door open and walk in. And they do ask a number of questions about what supplements they can use to get healthier as they are picking up the couple of prescriptions they may be on. I don't really dispense any maintenance meds. A lot of what we do is in the hormone therapy space, but aligned with you at GoldCare, I'm very pleased. I feel good about this because I know that overprescribing medication is a bad thing. Having emergency medication on hand for when patients need it, okay, that's excellent, and it's really rewarding.
I love it. So we're able to drill down for people that there's a difference. Like you can both love pharmaceuticals when you need them and also not want to be on chronic medications. And you have three professionals with lots and lots of experience. We're telling you that most chronic medications, we need to take a second look at that. But there are times as acute medications we want to have close to us, and we've experienced that doctors and pharmacists both block it. MAHA, right? The word MAHA, like it's just, it's been our mantra for the last couple of years. And sometimes when I try to explain to people, what is GoldCare? They're like, what is GoldCare? I'm like, but you have independent doctors who are thinking for themselves or not being beholden to any, big corporate interest or big pharmaceutical company. They're independent doctors, but this is a practical way. When you think like, how can I, Maha? Like, how can I make myself healthy? How can I do it for me? Well, one of the ways you can do that is take control and have these things available to you. I mean, it's kind of crazy that we have less options available to us as Americans than they do in other nations. It's very strange. It's one of the things I discovered during COVID, that if I lived in a third world country, I could get access to other medications that I couldn't, living in, metropolitan America. Like, I found that really troubling. I found that really problematic. So how do you Maha for yourself is you be ready. You be ready. So you need a doctor who's not going to overprescribe. You need a pharmacist who actually cares about the quality of the ingredients that are delivered to you, that they actually care about that, and also isn't in the habit of pushing. We all have walked into the chain pharmacies and they're pushing lots and lots of other things that maybe we don't want to put in your body. So you want to have a relationship with a pharmacist that actually cares about what goes into your body. And you want to be proactive for yourself. You want to make sure you have these things available if you need it. I can tell you that all of these medicines in the pack that it took us months to decide what to put in the pack are things that I believe as an emergency physician, you should have in your home. This is what Dr. Gold has in her home. This is what I have. This is what I need. This makes me independent. Unlike anybody else. I could get sick too, or I can have a problem too. And I don't really want to run to the hospital. I don't really trust that situation, right? I need to be independent as well. I'm not a pharmacist. I can't get my meds for myself magically as a private American citizen. I need to be ready. So we're teaching you how to be ready for yourself. If you're usually, the woman of the house is taking care of the husband and the kids and the parents, right? So you should be taking care of all these people. All of the people in your home should have this. And I just feel so passionately about this. That's actually why we're doing this town hall. But I will zip my lip right now and turn it back to Dr. Atkinson. I'm just, what I'm saying? Like, I'm so excited about this because we have amazing quality pharmacy on the one hand, and we've got amazing doctors and APPs that can help you decide if it's right for you.
Right, and I'll take it, one step further. So we're talking a lot about medications tonight and about our prescribing doctors that are able to get on calls with you on telemedicine and advise you and add additional prescriptions if needed, or advise you not to take a prescription because it's not necessary. But we emphasize very, very strongly on GoldCare the holistic side of medicine. So we have naturopathic doctors and holistic doctors and functional medicine doctors that are, if actually you kind of look back as a doctor, you probably experienced this, Dr. Gold. I think we were trained to sort of feel like we were sort of on high, and some of the other practitioners out there, were sort of lesser trained, first of all, we weren't given any education whatsoever about what they were telling patients about. But for me anyway, personally, with COVID, I saw how horrible doctors were treating patients and ERs. And I talked with naturopathic doctors who, like some of our medical colleagues that had hundreds and hundreds of patients that they treated, say with hydroxychloroquine, there were naturopathic doctors that didn't use hydroxychloroquine or ivermectin and had 0 patients go to the hospital, 0 deaths. They were treating with natural modalities and natural supplements and so forth. So for Maha, how do we Maha? Well, that's a major way. We have sort of classically trained allopathic doctors absolutely on a par, on an equal level with naturopathy and holistic medicine, and they're easily as accessible as doctors of classically trained medicine on our website.
That's right. Let's just use COVID as an example because people are so familiar with it. But obviously, hydroxychloroquine and ivermectin were good if given early, with zinc. So was quercetin, which is, I think, what you were intimating. That's something naturopaths knew better than I did. But also, the allopathic, the MD doctors were not telling their patients their vitamin D levels had to be good, right? The people who had low vitamin D levels are the ones who landed in the ICU. Your glucose had to be normalized. So even if your glucose was out of control other times because you weren't eating well and you were overweight and you weren't exercising, at least during the COVID episode, you had to control your glucose. And if you did that, your chances were much improved. And those are the types of things that, I'm sorry, but like our allopathically trained, medical trained, osteopathic, MD, DO physicians we're not doing as well as our naturopathic doctors. So that's why we put them together. It's not competitive. It's both. It's all there. Sometimes you need prescription medicines. Sometimes you don't need prescription medicines. We're agnostic. We want to get you what you need when you need it. I honestly, I want every single person who isn't already a GoldCare member to join for this purpose. And everyone who is a GoldCare member who hasn't yet gotten themselves a pack is really doing themselves a disservice by not having these medicines at their home. They're very convenient. I can't think of anything you can do that's more important and more impactful for that moment when you need it. I will tell you that almost every day, somebody sends me a text or a DM on Twitter, on X, and they're asking me what they can do. And I said, well, have you gotten yourself a pack, a viral essential, viral prescription, or, an urgent pack, right? And if they haven't, I'm like, you know what, call me after you've done that, because, you're not doing your part. So you got to do your part. So Dr. Seik, I know that you're excited about all of this because you've watched kind of, in a way, the destruction, if anything, the pharmaceutical and retail pharmaceuticals, if anything, it's maybe worse than the medical industry, which is really a high bar to be worse than that.
Well, during COVID, there were probably 10 or 15,000 independent pharmacies that went out of business. The chain drugstores have excelled. And we've discussed before on other shows how the chain drugstores have started to purchase the pharmaceutical insurers, the private insurance. CVS owns Caremark, that's your largest PBM, pharmacy benefits manager. Walgreens owns 2 of them, and Walmart owns Humana. Those 4 PBMs control 80% of all prescription claims. And what this has created, which I don't understand why there's no anti-trade legislation or investigation into this, it's clear collusion, because both entities benefit from over-prescribing. It was initially done to control the margins so that the chain drugstores could control the margins, and they do. I'm so glad to be out of that game. Sometimes it's more difficult because you do have pharmacy boards that say, well, you don't take insurance, you're not offering the vaccine, you didn't make your employees wear a mask. I've faced all of those. And even today, 5 years later, I still have some echo effect of state boards asking me questions. But what I love about what you're doing with GoldCare and what you spoke to previously about a true functional approach, I went and trained myself in functional medicine. And why? Because pharmacists don't treat. My job, actually, for what I have to do for GoldCare, it's pretty easy. All we have to do is put the medication packs together, make sure they're accurate, and get them out the door in a timely manner. That's all we have to do. But our spirit of collaboration that we have is what's rewarding to me to work with your team, because I did train myself in functional medicine. And pharmacists make recommendations. And having some degree of experience in infectious disease research, yes, exactly what you said never came out of the mouth of your standard allopathic practitioner about the importance of the vitamin D level, vitamin D and magnesium, which enhances the effect. Yes, there are natural substances that cause zinc to rush into the cells. That's where quercetin comes in, zinc, vitamin C, N-acetylcysteine, and all of these things we talk about, except for the drugs, those nutritional interventions are actually documented in clinical studies to be effective. I research and I read those things, and it's really rewarding to work with physicians that have that collaborative spirit, because if I were a chain drugstore pharmacist and I had a standard, I call them the doctor in a box, work for the corporation physicians, and if I would discuss with them anything, vitamin D, what is that, quackery? That's just a vitamin. What are you talking about? Have you ever seen the data from Harvard School of Public Health? No, they don't need this. And it's just really strange sometimes, but not working with GoldCare, it's good.
Right. I think we're doing it the right way, because, we have that relationship with the patient, and it's pretty hard to look at a patient and think you're not going to do the right thing. So it's up for everybody. This is amazing. So when people do this appointment, the prescription pack or the urgent care pack appointment, you get this unbelievable informational resource, right? So inside this booklet, we explain the medicines that are included, and then we have information on all of the medicines. So you're doing the consult with the doctor or the nurse practitioner or the physician assistant in your state, licensed, they're knowledgeable, they're smart, they're mission aligned, they want to help you. They go over these things with you. They explain it to you. But, this stuff is hard to remember, right? That's why they went to school for so many years. And then the medicines come to your home with the booklet, right? And then you feel safe. You're like, okay, I've got what I need. Should I need it? And then maybe you forget about it. You put it in the refrigerator. You put it kind of in a cool, dry area. And then a couple months later, you need it. And you pull it out, but you're like, I don't quite remember. Well, why would you? You haven't been to school for 10 years. I'm not sure. We want you then to come back and do like a short appointment with us. Find out if you really should take a prescription medication. So do you understand, like, this is something also that built on my experience as an ER doctor. Patients would come to me in the ER and they were convinced they needed medication. They were convinced they needed a prescription medicine. Maybe they saw it on a TV commercial ad. And I knew that they didn't. I knew it wasn't the right thing. But it was very difficult sometimes to break down that resistance. And I discovered through experience that if I wrote the prescription for the patient, they calmed down. They understood that I wasn't withholding it from them. They could get it if they really, really wanted it, right? And then they would listen to me and they would take my advice because they saw that I didn't really have it. I want to put you, everyone listening to me, in that position. I want you to have the power, you to have the control, and then to use it wisely with intelligent guidance along the way. Dr. Atkinson, you'll have the last word, on this amazing subject, which is fitting because you put most of the hard work in.
Well, thank you. Yeah, I want to emphasize one more thing, which is that medications come with an expiration date, but that expiration date is something that is required from a business standpoint that they place on the medication, that it does not represent the medication no longer being effective to any degree whatsoever. There is something called the Department of Defense did, I think it's called the Shelf Life Extension Program. I know Dr. Seik has talked about this before, and they measured the efficacy of the active ingredient of medications, going on several years, and found a very minimal degradation in the effectiveness of the medication over that time frame. So I want to emphasize that you don't need to be concerned about that expiration date. The medicine is still good. It may over many, many years, 10 years, 15 years, it's probably not going to have the effectiveness that it would as a new medication. It won't, but it's also not going to be harmful. These things don't convert into something toxic, so you don't have to worry about that at all. It might be something that, 5 years from now, you might want to consider replacing some medications, maybe 10 years. I personally would not be bothered at all, going over 5 years with these medications. So just want to make that point as we get near the close.
And I want to jump on that and do a little bit of a disclaimer. We are not giving individual medical advice on this program, which is for the general public. It is true that medications mildly degrade over time. The important point is they don't become dangerous. And I think that that's a fear that we've been led to believe, right? If the milk has expired or the meat has expired, you think, oh my God, it's dangerous, right? So I think people just believe that, and that suits the pharmaceutical sellers to have you believe that. And I think Dr. Atkinson is just sharing with you that our goal isn't really to keep selling you packs. Our goal is that you should be prepared. That's our goal. And thank you. And that's a good point. And we also want to do the best thing for you financially, which is why, we work to give you a good product at a fair price that is in your best interest. Dr. Seik, I couldn't be more pleased that GoldCare puts you as a priority partner. I want independent pharmacies to be around forever. We saw what the chain pharmacies did. I'm just going to say something that you're too polite to say. I want to urge everybody listening, strongly consider switching your prescriptions that you have to independent pharmacies. The reason is that the chain pharmacies are happy to take a loss on the medications because they sell you the other goods, the shampoo, and there's a lot of reasons, but that's one of the reasons. But if the independents go out of business and they're constantly trying to do that to people, you are going to be up the creek without a paddle. I can tell you right now, we had so many problems with the chain pharmacies not helping you. So whenever possible, please consider switching over, just putting it out there. Dr. Seik, thank you for being always looking out for patients' best interests and the quality of the product that you put forward for patients. Thank you for this excellent, I had reviewed it when you had put it together. It was fantastic. Dr. Atkinson, thank you for your work in putting this together. Dr. Seik, were there any last words that you needed to get out there?
No, I just wanted to thank you for having me on and what you said about keeping the independent pharmacies in business. Yes, I encourage everyone, talk to your independent pharmacy. They're more open-minded almost always in general compared to the chain drugstores. And you're right, it's a land grab for chain drugstores to kind of control the last stop, which is what the practitioner authorized, and get it to the patient. And support your independent pharmacy, because if anything we experienced during COVID, those chain drugstores are more than willing to prevent your practitioner from practicing medicine by denying therapy. It's wrong. So let's keep independent pharmacies alive, because it's best for America's health.
Thank you so much. Thank you, Dr. Atkinson. And Drew, back to you.
Thank you, Dr. Gold. And thank you to our great speaker tonight, Dr. Seik, Dr. Atkinson, Dr. Gold. Wonderful conversation. Tonight is one of the driving forces behind why we created GoldCare, to help you make informed medical decisions for yourself and for your loved ones. It's also a powerful reminder that we have the ability to push back against the medical industrial complex. You don't have to trust blindly. You can and should question medical motives, especially when it comes to Big Pharma and their relentless desire to keep you prescribed for life. As believers, we're called to question the world, but to trust his word, because in him we find both healing and hope. Don't forget to retweet this live stream and click the link in the title of tonight's webinar to learn more about GoldCare, or simply visit goldcare.com/Dr. Gold to get your first month on us. Thank you so much for being with us tonight, and we'll see you at the next GoldCare Medical Town Hall. Good night.
Do you feel like the healthcare system is failing you? That's because it is, working exactly as intended to prioritize profits, bureaucracy, and Big Pharma, while leaving you and your family vulnerable when you need care the most. We understand your frustration. You've been asked to trust a system that feels rushed, impersonal, and biased. You deserve better. That's why we created GoldCare. Here, your values matter, your choices matter, and most importantly, you matter. GoldCare is more than a solution. It's a revolution. Trusted by over 10,000 members nationwide, we've built a system that puts your wellness first. With ethical, independent doctors who work for you, not the system, you'll have access to care that's transparent, trustworthy, and aligned with your values. We understand that stepping away from the familiar can feel daunting, but staying in a system that doesn't truly serve you is even harder. That's why GoldCare offers a healthcare alternative designed to work for you. Whether you're ready to step away from the system entirely, or prefer to keep your insurance while seeking the transparent care, ethical doctors, and education you deserve, it's time to stop trusting a system that's failed you. Take control of your health with GoldCare. Join today for just $10 a month and become part of the healthcare revolution. GoldCare, built for you, powered by freedom, trusted by thousands.